It's all good. We still know that it's us. All right, let's start. What is vascular dementia? So let's just back up. Umbrella term, the word dementia, umbrella term, underneath that umbrella are more than 100 different types of dementia, Alzheimer's disease being the most common type, form, or cause of dementia. We did a program on Alzheimer's disease specifically last month. It is up on the YouTube page right now. You can go and find it. If you go to our YouTube page, which Jamie put in the chat, you type in Alzheimer's, it will bring up that Alzheimer's program. So we're going through, I think we're going to do the top 5, the ones that we see over and over, although you heard me say there's over 100 different types. Now, we're actually going to find out today, vascular dementia has its own little umbrella, and I'm going to break it down. We're going to look at the top 3 types of vascular dementia. But let's see what happens in vascular dementia. Some of the newest statistics say that up to 80% of everyone who dies with dementia also had vascular dementia, and they may not have even known it, and we'll look at why. So what happens in vascular dementia? It's exactly what it sounds like. Vascular, cardiovascular, meaning it has to do with the heart. So vascular dementia is caused by a decline in skills because of a reduction of blood flow to various regions of the brain. And because of there is a reduction in blood flow, that means the brain is deprived of oxygen and nutrients. Even if it's for a short time, it does damage over time. And again, we are really gonna deep dive into this. Eventually, what happens with vascular dementia, especially if a person's having multiple TIAs or little mini strokes, talk more about that, it eventually kills the cells in the brain. This is the only dementia that can occur suddenly. Think about that. All of the other dementias come on gradually. Now, sometimes we might think it comes on suddenly. We may say, nope, they were fine. They had general anesthesia. They woke up with dementia. And then you start to educate yourself and you realize there's so much more to dementia than memory loss. And that all of those signs and symptoms that maybe you thought were aging or hearing or vision or something else was actually the dementia was there all along. But after that general anesthesia, bam, there it really showed up, because general anesthesia is the #1 accelerator of dementia. But with vascular dementia, it really can come on suddenly, because a person can have a stroke, and after that stroke, there's vascular dementia. The stroke can block the blood vessels, the blood flow to the brain, and then there's the dementia. And we will explain this even better, and I found some great little short videos we're going to watch also. Many times, the way that vascular dementia will begin is just with some thinking difficulties, and it can be very, very mild. And I mentioned earlier the TIA, transient ischemic attack. These are tiny, multiple minor strokes. I'm going to show you a picture of what it looks like on the brain in just a minute. Some things that cause this. This is the one dementia also that we know for sure we have some control over. Just like we know we have some control over what's happening with our heart. That's why it's called vascular dementia. Keeping our diabetes under control, not smoking, keeping our hypertension, our blood pressure under control, our cholesterol under control, being at a healthy weight, fighting depression. We'll talk more about that. Sleep apnea. There are now direct links between untreated depression and untreated sleep apnea. Because think about what's happening. Sleep apnea, we stop breathing for periods of time why we wear that CPAP. Depression changes the chemical makeup of the brain, especially if it's for years and we don't treat it, and we wind up with dementia. As I was saying earlier, vascular dementia very often coexist with other dementias, and we'll look at that. It's called mixed dementia, especially Alzheimer's disease. It also often coexists with depression, because depression is one of those things that, because there's a stigma, just like there's a stigma to dementia, many people don't treat their depression. They don't even admit that they have depression, or they don't understand exactly what depression is. You can be depressed and not feel sad all the time. Being sad is one symptom of depression, just like memory loss is one symptom of dementia. There's about 36 common symptoms to dementia. There's over 20 common symptoms to depression, but most people only know of one or two. Now, typically what will happen when there's a chronic blood vessel problem, such as diabetes, high blood pressure, cholesterol, it will come on slowly, because the condition is very slowly beginning to narrow those blood vessels. And so it is just over a period of time starting to deprive the brain tissue of oxygen. And so we just have subtle changes. That's why sometimes families don't even realize or recognize what's happening until something major happens. Vascular dementia, right now, when you look at the statistics, it is the second most common type of dementia, right behind Alzheimer's disease. Now, there are some statistics I was looking at just earlier this morning that shows that mixed dementia is number 2, but we're going to see that mixed dementia is a form of vascular dementia. 20% of people who suffer from a stroke will develop vascular dementia within about 6 months after that. And the extent of brain damage influences the severity of the dementia symptoms. What's interesting with vascular dementia is many times people who have vascular dementia their personality will stay intact for a very long time, and judgment will stay intact for a long time.
You get cash back.
One of the reasons that we are seeing more the prevalence of vascular dementia is because there is an increased presence of cardiovascular disease. So think about that. All of our baby boomers now are over the age of 60. All baby boomers now are over the age of 60. Diets have changed. What we're breathing in and out has changed. Prevalence of smoking, drinking, prescription meds, non-prescription meds. How well we're taking care of ourselves. How well have we taken care of ourselves for the last 30, 40, 50 years? And more people are getting diagnosed with cardiovascular disease. There's where we draw the direct line over from cardiovascular disease to vascular dementia. So, some more about the symptoms. They can vary widely because it depends on the part of the brain that's damaged, and it depends on the severity of the blood vessel damage. Memory loss may or may not even be one of the significant early symptoms. I've had people who could even after placement, personality still intact, judgment still intact, still call me by name, but it depends on where the damage is in the brain. Let's look at some more symptoms. Some of the most common symptoms that we see in vascular dementia: confusion, that state of confusion, a lot of disorientation, maybe some trouble speaking or finding the right words. Now, don't panic if you're somebody who goes, now, wait a minute, it's on the tip of my tongue, I just can't find it. You're realizing you can't find it. That's probably stress, to tell you the truth. But a person who truly has dementia, They're looking, they're maybe getting mad at you because they can't find the word, or they start using a lot of thing and stuff. You know, the stuff, that stuff. Some physical symptoms such as trouble walking, headaches, numbness, paralysis, depending on where the damage is to the brain. You may see impaired planning and judgment, having a hard time with organization. That's pretty common, having a very difficult time being organized, paying the same bill multiple times or not paying a bill. Problem solving, something that can seem relatively minor, but it becomes a big deal because they just can't figure out how to problem solve. We are going to watch a short video in just a minute about pseudobulbar, I'm not going to say it right, effect. It can also be called emotional incontinence. It's pretty common with vascular dementia, but sometimes families don't have any idea what it is, and even doctors can misdiagnose it as a type of mental illness when it's actually a symptom of dementia. That declining ability to pay attention, especially to pay attention to tasks. It's too hard, I'm just going to stop doing it. I can't figure it out, I'm going to stop doing it. There's too many steps, sequencing becomes an issue, just walk away. Some impaired function in social situations. We've mentioned having a hard time finding the right word, and they will remain stable for a period of time until the next cardiovascular incident. This is what makes it different from the other dementias. It's a cardiovascular incident. Many times, again, it's a TIA. But let's look at 3 different types of vascular dementia. We're going to break it down into these 3 types. Mixed dementia. Okay, we've got the umbrella that says dementia. Here's all the dementias. We've got another little umbrella over here that says vascular dementia because there's different types of vascular dementia. We've got another umbrella over here that says FTD, frontotemporal dementias, because there's a number of FTDs. That's why there's over 100 different types of dementia. Subcortical vascular dementia and multi-infarct dementia. We're going to look at each of those. First is mixed dementia, the one we've been talking about. This occurs when vascular dementia and another dementia, usually Alzheimer's, but not always, coexist. And I was able to find this graphic. So let's say that the person already has hypertension, already has diabetes. They haven't been well controlled. So there's the vascular dementia part of it. And then they develop Alzheimer's disease. Now they've got what's called mixed dementia, but it could be Lewy body dementia with vascular, and it would be called mixed dementia. They could have Parkinson's disease dementia with vascular, and it would be called mixed dementia. All mixed dementia means is that there's at least 2 types of dementia, and it's almost always vascular. That's the other type. And I said earlier, the latest statistic is about 80% of everyone who dies with dementia also has vascular, whether they knew it or not. The next one, you may have heard it called subcortical vascular dementia, but it has another name. This is called Binswanger's disease. It is the small blood vessels that lie deep within the brain. And what happens to them, you can see it on this picture here, those blood vessels become very, very thick. They become stiff, they become twisted, and they become damaged. So they get damage to the white matter, which is the deep tissue of the brain. It's an interesting form of vascular dementia. I found a great video on Binswanger's that we're going to watch next. And I want you to listen to, because you may start hearing some things that might be common in your loved one. Let's see. So, Binswanger's disease. Let's watch this real quick.
At Grand Canyon University, we believe in equal opportunity, and the American dream starts with purpose. Honoring the sacred vocation of nursing, you impact your family, your friends, and your community. GCU's RN to BSN.
Today's topic is Binswanger disease. Binswanger disease is a progressive form of dementia caused by widespread microscopic areas of damage to the blood vessels that supply the white matter and affects the deep structure of the brain. The white matter is found in the deeper tissue of the brain. It contains millions of nerve fibers that connect other parts of the brain and spinal cords and carry nerve impulses between neurons. Many of the nerve fibers are protected by a fatty material or sheath called myelin, which gives white matter its color. Myelin also protects the nerve fibers from injury. Any damage to the white matter causes the myelin to break down, resulting in problems such as delayed memory or mental deterioration. This progressive neurological disorder develops after age 60 and increases in severity with age. This disease is also referred to as subcortical vascular dementia. While many dementia results from damage to the cortical portion of the brain, Binswanger disease and some other diseases such as Parkinson's disease, Alzheimer's disease, Huntington disease, and dementia associated with AIDS result from damage to the subcortical areas of the brain, especially the subcortical connections. Causes: Binswanger disease is caused by atherosclerosis and thromboembolism and other diseases that cause an obstruction to the blood vessel supplying the deep structures of the brain. A narrowing and thickening of the arteries that feed the subcortical portion of the brain may occur. As the arteries become more and more narrowed, blood supplies reduce and brain tissue dies. Risk factors for the condition include diabetes mellitus, hypertension, smoking, hypercholesterolemia, heart disease, rare hereditary diseases such as CADASIL or cerebral autosomal dominant arteriopathy, with subcortical infarcts, and leukoencephalopathy. Symptoms: forgetfulness, changes or difficulty with speech, frequent falls, urinary problems, changes in personality or mood in form of apathy, aggression, depression, or withdrawal from family, friends, and coworkers, an unsteady gait or poor balance, difficulty with swallowing, inability to make decisions, and intellectual impairment such as difficulties to think or reason, language difficulties, problems reading and writing, memory loss, confusion, exhibiting poor judgment. Diagnosis: a tentative diagnosis can be made by evaluating patient's history and symptoms. A proper diagnosis is made using imaging tests. Brain imaging studies, such as CT scan and MRI, can detect and reveal characteristic lesions in the tissue located in the inner white matter of the brain, common to Binswanger disease. Treatment: the damage associated with the condition is irreversible. However, treatment options may help to decline or slow the progression of the cognitive decline. Treatment options may include managing risk factors that contribute to the condition, such as hypertension or diabetes. A successful management of these conditions can slow down the progression of atherosclerosis and subsequently slow down the progression of the condition. Antidepressant medications, such as SSRIs, may be recommended for people with anxiety and depression. Antipsychotic drugs may be useful in people with agitation and aggressive behavior. Lifestyle changes that can help include eating a healthy diet, regular exercise, smoking and drinking cessation, keeping a good sleep schedule. Thank you for watching our video. Please.
That is the best video that I have found on Binswangers. And so much of what they said, I hope that you really caught that whenever he mentioned depression, treating depression. The link has become more and more clear between untreated depression and developing vascular dementia. He also mentioned a lot about lifestyle changes because, as I said earlier, when we first started this, vascular dementia is the one that we really have an awful lot of control over from the beginning. So let's look at the next one, the multi-infarct dementia. It is much more common than single infarct dementia because it is a result of a series of strokes. TIAs, which we're going to look at, typically last no longer than 24 hours. In fact, if a person is having TIAs, sometimes families will know because they will sleep for about 24 hours after they have a TIA. There seems to be a subtle change for about 24 hours. And what it leads to, I'm about to show you some pictures, is areas of dead tissue, which results in a failed blood supply to the brain, which results in vascular dementia. So let's take a look here. You can see where these arrows are pointing to damage on the brain. Some of them are little areas, but once that particular area of the brain has enough damage and it has died or it has failed, because we know with dementia, we all start with that normal size brain is about 3 pounds. In stages of dementia, the brain is about 1 pound. So some of the things that's causing this to happen, he mentioned this in the video, not getting enough nutrients and oxygen to the brain because the supply is cut off for one reason or another. Because blood vessels are like a tube. And when something clogs that tube, oxygenated blood cannot get to the brain. Nutrients cannot get to the brain. And without that blood supply, the brain cells die. That then causes the symptoms of dementia, and that then begins to impact daily life. Here's a really good graphic for us to be able to look at and see, okay, whether it's something like plaque that we see with cholesterol, or it is something like a blood clot, regardless of what it is, we're not getting that oxygenated blood up to the brain. Now, you've heard us talk about stroke, because stroke is the #1 cause or reason that somebody develops vascular dementia. And you may have seen this before about there's treatment for stroke if you act fast, F-A-S-T. So you look at a person's face to see if one side is uneven, is one of the arms hanging down, is the speech slurred, and that you need to call 911 immediately. Some of the other things that we might see with stroke, and we are going to look at these 3 particular types of stroke. Why do they take place? Because suddenly that blood carrying oxygen to the brain is cut off. And there's about 3 different reasons that happens. This eventually leads to that vascular dementia. Now, not everyone who has a stroke is going to develop dementia. We looked at those statistics earlier, especially if they start making lifestyle changes immediately. Some of the things that we can see after a stroke, the paralysis, numbness, confusion, headaches, trouble with their vision, a metallic taste in the mouth, difficulty swallowing, and trouble walking. So here's these 3 different types of stroke, and let's look at each of them briefly. First, there's the ischemic stroke, and here's a picture of what that looks like. It occurs when a blood clot or other blockage obstructs blood flow to part of the brain, leading to tissue damage and then that potential brain cell death. So you can see there the normal artery and then the blocked artery. There's still some blood getting through there. Look at the difference. It's an obstruction to blood flow. So I've had people say to me, well, my loved one or I myself, I've been smoking for 40 years. I haven't had any issues. Well, if we've been smoking for 40 years, it's been happening over a period of time. So of course, we wouldn't necessarily just realize what changes have been taking place until that completely blocks off. Or diabetes being controlled, or cholesterol being controlled, or obesity. All of the many things, if it is bad for the heart, it's bad for the brain. Let's look at that next type of stroke. This is the hemorrhagic stroke. This is when a blood vessel in the brain actually ruptures and it causes bleeding into the brain. This can lead to some very serious neurological damage and to disability. And there's a great graphic there showing what happens. And then we've mentioned this one a lot, that TIA, the transient ischemic attack, TIA. It's a mini stroke. It's a temporary disruption of blood flow, usually resolves within 24 hours. We see this over and over and over again. But what happens, that brain that we looked at earlier, sometimes they'll even call them pinpoint strokes, because you look at that MRI and there's all these little, what looks like pinpoints. We eventually have enough of those and we start seeing the symptoms of dementia. Now, we mentioned earlier about the stroke, getting to the doctor as fast as we can, getting to the ER. They'll do an MRI. They may do a CAT scan. They may do an ultrasound, because one of the reasons they do that ultrasound is to check the blood flow in the carotid arteries. How do we prevent stroke? Number one is going to be diet. We'll look more at that. Exercise, getting oxygenated blood up to the brain. That does not mean we have to take up jogging. That does not mean we have to do jumping jacks. It can be something as simple as, lots of times I'll have the little stress balls here in my office. What if I just sit here and did those stress balls back and forth, back and forth, back and forth, back and forth during the commercials on TV? I'm moving. I'm pushing oxygenated blood up to my brain, doing something other than just sitting on the couch. Controlling diabetes, cholesterol, blood pressure, making sure that we stop smoking, not using illicit drugs or alcohol. There are medications, because there are clot dissolvers. There are anticoagulants. They can do surgery. They can go in and clean out the carotid arteries. They can do surgery on the heart. There's angioplasty. There's stents. They can clip aneurysms. We've mentioned diet again. It's going to come up again and again and again. And then I found this today, and I thought this was one of the best I've seen. It's a new paper that's out, and I've put the link to the paper at the very top of this slide, which you'll be getting. Vascular Dementia Risk Factors. So let's look at this and look what has made the list. Sleep disorders. That's where I was saying we've been studying, we've been following how sleep apnea and depression are now risk factors. And here it is. Low physical activity. Having had a stroke in the past, it puts you at a higher risk. There's a genetic factor. Sex and age. We tend to see more women with dementia than men. Women tend to live longer than men. There's diet. There's diabetes. Now, when it says cardiovascular risk factors, what those are, that is high cholesterol, high blood pressure, high BMI, so obesity, and here's another one you may not have seen yet, that AF, atrial fibrillation, AFib. And here's the psychological factors: depression, low leisure activities. We're not being very social. Maybe we're not laughing much at all, and we're sitting in a pool of cortisol. When do we have some serotonin and some dopamine? Notice it says non-complex job. Maybe something where we're just kind of rote, doing the same thing over and over and over and over. Our brain needs to be challenged. Smoking and alcohol's on there also. Some of you have heard me do the example. If we go to the gym, I'm going to get my body, I'm going to work on it. But I take one barbell and every day I'm lifting that same barbell with the same arm. Before long, I'm going to have a great looking right arm. But what's the rest of me going to look like? Same thing with our brain. But I watch Wheel of Fortune every night. That's wonderful. Keep watching Wheel of Fortune every night. What else are you doing? I play the easy crosswords. That's great. Have you played the medium crosswords? Challenge your brain. If it's difficult, good. We want to challenge our brain. I used to hate the Sudoku games. I think that's how you say it. I'm a master at those now because I made myself sit and learn how to do them. Challenge your brain. Okay, let's look at depression. I've been talking about depression, vascular dementia. 1/3 of people suffering with depression get treatment. That means that 2/3 never mention it to their doctors. We use the big F word, I'm fine, when they ask us at the doctors how we're doing, because they're required to ask us now. They're even required to ask us some specific questions. Did you know 80% of the time depression can be completely alleviated? 80% of the time. That means that 80% of the time we can keep that link between depression and vascular dementia at bay. But we have to do it. 100% of the time we can alleviate some of the symptoms, even if we have treatment-resistant depression. We can alleviate some symptoms. We've got to talk about it. And if you are a caregiver of somebody who has dementia, or if you work in the field of dementia, the chances of you having anxiety and depression are pretty high. Talk about it. What happens when we have anxiety and depression? We actually have chemical changes going on in our brain, in the hippocampus. And what happens in the hippocampus? Memory center. And those days turn into weeks, turn into months, turn into years, and it does permanent damage to our brain because we didn't reach out for some help with something that we could have treated. Another area of the brain that gets damaged by depression is the conflict resolution center. The prefrontal cortex, where we can plan and have executive function. And it's damaged by something that we can treat. And there's all types of treatment for depression. It is not just antidepressants, which are not anything to be afraid of. And they usually are temporary because likely what you're going through is what's called situational depression. We've got to protect our brain. One of the ways that we do that, again, we have mentioned diet. We're going to mention it over and over and over again. Exercise, taking your medication as it is prescribed, not smoking, limiting alcohol. Now, when I said diet, I'm going to ask you to specifically look at a diet called the MIND, M-I-N-D, MIND diet. It was created by a neurologist in 2015. It is a combination between the Mediterranean and the DASH diet, which is for hypertension, and it's called the MIND diet. It basically has 10 do's and 5 not so much. It doesn't even say don't. It just says not so much. So take a look at that. And then we want to avoid general anesthesia if possible. General anesthesia is when you're intubated, when it is down the throat, intubated. I'm not talking about back of the hand twilight. General anesthesia, it progresses dementia. Now, we talked a little bit about this next effect of vascular dementia. We see and again, I'm going to mispronounce, pseudobulbar effect, an emotional mismatch. we're going to watch about the first 2 minutes of this because I want you to understand exactly what it is in case you're seeing it in your clients, if you're a professional, or in your loved one, if you are a family caregiver. This is pretty common with vascular dementia.
Pseudobulbar affect, or PBA, is a medical condition that results in sudden and uncontrollable episodes of laughing, crying, or both. PBA is pronounced pseudobulbar affect. It's a disorder that affects some stroke survivors, as well as people with dementia, traumatic brain injury, Parkinson's disease, MS, or ALS. Sometimes a stroke can damage the areas of the brain that control normal expression of emotion, and a disconnection occurs, triggering episodes of uncontrollable crying and or laughing. While mood is how we feel emotionally inside, the term affect describes how we display our emotions to the outside world. In stroke survivors with PBA, mood and affect are disconnected. Healthcare professionals call this mood incongruent affect. PBA is sometimes called emotional incontinence. Just as a stroke survivor may lose control of his or her bladder, also known as incontinence, this condition refers to the inability to control the display of specific emotions. And just like incontinence, PBA can also be disrupting and frustrating. PBA episodes can be triggered by something that is only slightly sad or funny. For example, a funny commercial about puppy dogs may cause tears. A person with PBA may laugh at something that's sad or cry at something that's funny. PBA episodes can also be exaggerated from a person's true feelings. For example, they may sob uncontrollably at something that is only slightly sad. For people with PBA, the disconnect between internal emotions and external expressions can be frustrating, both for them and their loved ones.
Okay, I hope, and when you get a copy of this video, you'll be able to click on that and watch the full video. But I wanted you to just understand what it is. It's the disconnect. It's the disconnect between what I'm feeling inside and what I'm doing outside. It is we'll see it in all of the dementias, but we tend to see it more with vascular. So how do we get someone diagnosed? We can see it now. You saw in the video we watched a little bit earlier about MRIs, CAT scans, PET scans, measuring brain function. It gives us a snapshot of what's happening right then. It shows evidence of strokes. It shows evidence of other vascular changes. Now, what are the outcomes? This is some of the latest statistics. For somebody with vascular dementia, their life expectancy tends to be a little bit lower than the other dementias because of the vascular issues. It's very common for a person with vascular dementia to not go all the way to those last stages of dementia because they have either a massive stroke or a massive heart attack because of their cardiovascular issues. Now, keep in mind, we don't have any treatments for dementia, for any of the dementias. What we have is we have treatments for the symptoms, and there are many treatments for the symptoms that are out there. We continue to control the risk factors very early on if somebody gets diagnosed with vascular dementia, and we can start to change the diet, start to get in more exercise, remain social, starting to do some of those brain games, working on sleep hygiene. We want to try to hit that plateau and ride those plateaus as long as possible. And the Alzheimer's Association has even put out evidence that treatment of risk factors improves the outcomes and helps postpone or prevent further decline. Vascular dementia, again, the one that we have some control over. I want to quickly go through some of the things we may see stage by stage. So earlier in the disease, some of the things that we can do if we've got a loved one or clients who have vascular dementia. this is going to be that normalization stage. We want to keep things as normal as possible, but we might want to use a lot of reminder setups and cues. They may start to misinterpret their words or not make the connection between this word and this object. They may also miss some words or start to misuse pronouns. You may see them getting off task easily. We mentioned earlier when we were going through the symptoms, almost like a attention deficit disorder type thing, where it becomes too difficult. I can't do it, so I just walk away. I don't even want to try. So they may also lose the loss of awareness of body and position. They can't necessarily express their pain or locate their pain, but their body will be able to tell you, because you will see a furrowed brow. You will see the frown. But if you just ask them, are you in pain? You're likely going to get no while they're holding the area that's in pain. They're not making the connections because of the damage that's done to the brain. A loss of fine motor skills is something we may see earlier in the disease, and they may not be able to make their needs known like they had previously been able to. In the middle stages of vascular dementia, and this is similar to the other dementias, we're going to call this the supportive stage. They're probably needing help with everything at this point. This is where we want to come in and support them, but allow them to remain as independent as possible and keep their dignity intact. This is a fantastic time to get into an adult day program, to get into support groups for families as you are getting further into the disease. They're going to require some more direct care with their ADLs, those activities of daily living. We also want to start to reduce distractions, because as we move more into the middle stages of vascular dementia, all of everything else going on around me is going to be a distraction. Some of the things that we can do. So statistically, what we have found, and we try to not use the word behavior, but we want to use the word expressions. About 80% of those challenging expressions or behaviors, they come from our approach or from the environment. So especially as we're moving into these mid-stage of the disease, we as professionals and families, we have to accommodate the disease. They can't. They would if they could, but they can't. So we have to learn how to accommodate their disease. We want to speak directly to them. We want to make sure that we're making eye contact. We're going to make sure that there's no other noise going on. We're going to check the lighting in the room and make sure there's not any shadows on the floor. You have to continue to educate yourself. Give them step-by-step instructions. Bring those choices down, the red shirt or the blue shirt, while we're keeping our voice up, because they're still going to be able to read you. They will still be able to read your gestures, your cues, your facial expressions, even if they appear to have a flat affect. And in the late stages of vascular dementia, this is more of a sensory type stage. Usually in the last stages, this is total care. Maybe down to 10 words or less. No will remain. No's one of the first 10 that we learn. No typically remains. And they're probably going to have a lot of trouble understanding speech. So we're going to use a lot of gestures. It is common for someone at the last stages of the disease to sleep up to 20 hours at a time. It's okay. At the beginning of life, infants can sleep up to 20 hours at a time. At the end of dementia, it's very common for someone to sleep up to 20 hours at a time. I want us to conclude. This is kind of going to be the summary. We're going to watch this last video, which is going to be like a summary. I'm going to go back through. We'll check for questions, and we will open it up to any questions that you may have thought of along the way. That was a lot of information in a hurry. As Jamie said, this is going to be up on our YouTube page probably before the end of the week, if not the beginning of next week. And you're going to get a copy of this, plus a copy of the slides. So let's watch this summary.
What is vascular dementia? Vascular dementia is the second most common type of dementia. It is caused by problems with the blood supply to the brain. Nerve cells require oxygen and nutrients to survive. Without them, they will become damaged or die. Cells are provided with oxygen and nutrients by a network of blood vessels in the brain. When the blood supply to the brain is interrupted, for example by a sudden blockage or a leak, this is called a stroke. A stroke can cause significant damage to parts of the brain. When the parts of the brain responsible for memory, thinking, or language are damaged in this way, a person will have difficulty remembering things, thinking, or speaking. These are all symptoms of vascular dementia. Sometimes, a single large stroke is enough to cause the symptoms of dementia. This is known as post-stroke dementia. This scan shows damage to the brain of someone with post-stroke dementia. In other cases, a person may experience a series of smaller strokes that gradually cause damage. This is known as multi-infarct dementia. Following a stroke, a person's symptoms may remain constant for a while. Then, if the person has another stroke, they may notice a sudden worsening of symptoms. This is known as a step-like progression. Small vessel disease is where there is a narrowing of the blood vessels deep in the brain. Small vessel disease is the most common cause of vascular dementia. As the narrowing affects more small blood vessels and more of the brain becomes damaged, the person will experience a gradual loss of abilities. Usually, people with small vessel disease notice a slowing of thinking and problem solving. For example, taking longer to think of a word and write it down. Evidence suggests that lifestyle factors that promote a healthy blood supply, such as regular exercise, not smoking, and eating a healthy diet, could help to reduce the risk of vascular dementia. There is currently no cure for vascular dementia. However, by controlling underlying cardiovascular diseases which affect the blood supply, such as high blood pressure, high cholesterol, and heart disease, it may be possible to slow down the progression of the condition. Vascular dementia will affect people differently, depending on the parts of the brain that are affected. However, a common symptom is having problems with planning and organizing, or with concentrating. It can help to break complex tasks down into smaller steps, and to make sure that environments are not too busy or noisy.
So some of the things that you heard over and over again on their diet, again, and I mentioned the mind diet, exercise, and the point of the exercise is the oxygenated blood up to the brain. Staying social, challenging your brain, doing something that challenges your brain. That could be on the phone. There's all kinds of games that are on the phone that get a little bit harder as you play them. Now, we tend to want to play the same games over and over because we get so good at them. I won. We need one that beats us every once in a while, that challenges us. So, lots of information really fast. Jamie, anything in the chat you either weren't able to answer or that we need to go back over?
There was one question that just popped in there. Will vascular dementia and dementia lead to the patient dying sooner?
So vascular dementia, all dementias themselves are terminal. They are a terminal illness. So yes, that's the short answer, I guess. Vascular dementia, like the one slide said, and I took those off of that paper that I found today that had changed a little bit. We tend to see a person with vascular dementia. Now, I'm going to say tend because there's always that person that's the asterisk to everything that gets vascular dementia and lives for 20 years. There's always going to be that person, just like there's going to be the person who gets diagnosed and they live for 6 months. We just don't know. Do they tend to pass sooner than the other dementias? That's what the statistics show, especially if we don't continue to treat the cardiovascular issue. So if they are having strokes and they prescribe an anticoagulant or whatever it is that they might prescribe, we need to stay on. Or if they are someone who has high blood pressure, we need to stay on top of the blood pressure or the diabetes or the cholesterol. That's where it comes in. And you saw that once, I loved the graphic where it showed Alzheimer's disease kind of steady going down, 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 where vascular, those plateaus can last for a long time. And then it's like a drop off. They'd have a step down because of usually a TIA or another cardiovascular, something happens. So yes, it is terminal. All of the dementias are. Somebody did put in there a detailed guide for beginners to the MIND diet. You can Google MIND diet. There's books out there on the MIND diet. Can circulation problems lead to vascular dementia? Yes, it can. Anything that has to do with circulation, anything, and I mean anything that has to do with the heart, if it is any type of a disturbance in the blood flow in any way, shape, or form, yes, it can lead to vascular dementia. That doesn't mean it's going to, it means that it can. That's another, if we get diagnosed with something like that, I'm jumping on the MIND diet today. I'm getting the something to do some type of exercise today. I'm laying down the cigarettes today. So making those changes. And again, if you haven't ever looked at the MIND diet before, I encourage you to do so. People hear diet and go, oh, but again, there's nothing on there that says you can't, because one of the things you're going to see, those of you that are in Texas, which I think a lot of you are, it says to limit red meat. Limit, but it doesn't say no red meat, because that would be so offensive to those of us who live in Texas, because we can't limit our red meat. It's part of living here. It's a necessity. So, but again, even on alcohol, it talks about red wine. It even gives the specific type of red wine. Now it's 5 ounces a day. 5 ounces a day. That is not the bottle. Suggestions for an alternative for chicken and fish if you are a vegetarian for the MIND diet. I actually have, Jamie has been a vegetarian for quite some time. What are some things that you do?
I do a lot of chickpeas and hummus. So those beans, those lentils, that is a great, because you got your protein, you get a lot of other nutrients in there as well. And tofu is good as well. I know there's like controversy around it and soy intake, but there's more positive benefits for tofu than what you might see out there in regards to the soy intake, which is kind of minimal actually at the end of the day. But those are some good alternatives. And they do have a lot of alternative meats, right? Vegetarian meats in that section of your grocery store. And some of them are pretty decent tasting. I would just say, just watch what all the other ingredients are. Some of them are better than others, just like with everything in the grocery store. But there's some good things out there.
Yeah, thank you. We are right at time. The beans and the lentils. It is high on the beans and lentils. And I just bought a couple of books on the MIND diet, and I went to Half Price Books. Just go to Half Price Books, get it for $3 rather than 20 on Amazon. So if you've got a Half Price Books around, go and check it out. We're glad you were here. Be looking for an email later from Jamie, and then this will be up and on YouTube shortly. If you're going to be on the support group, we'll be meeting at 1 o'clock. I sent that link out earlier. So appreciate y'all being here. We'll see you again soon. Bye, everybody.